Now, we're gonna have a report on health, nursing, and wellness. Sue Franchi, welcome to the school committee meeting, and we're gonna give you the floor. And put the mic as close to you as you can there, yeah. All right, you're right there, you go. All right, and you can introduce yourself and take over.
Hi, I'm Susan Franke. I'm the Director of Nursing for the Arlington Public Schools. I will be joined in a second by a colleague of ours, Ivy LaPlante, who is the Director of the Arlington Youth Health and Safety Coalition, and we're collaborating on some projects together, which I'll get into briefly. So I'm just reviewing what's going on in terms of wellness in town. Arlington thrives in terms of wellness comparatively to the rest of the state. Overall, it's a pretty healthy community. What we maybe struggle with is the same thing everyone else struggles with in terms of mental health in our youth, but we'll touch on that briefly. So thank you for letting me address the wellness initiatives and accomplishments this year, and we've continued to meet 4 times a year. Our last meeting will be June 1st. So I'll start with the physical fitness initiatives. All of the schools continue to run programming for students, which includes Fit Girls, amazingly popular, and Fit Boys and other running programs for boys as well, with different titles. And there are about 250 4th and 5th grade girls in the Fit Girls program, which has been very successful. Also, the Bach Be OK, Bach, morning workouts continue, basketball, Zumba, PE Plus, and the 521 program at the Audison. Arlington High has morning badminton, and the fitness room continues to remain open. I believe Larry Cronin from Fitness First donated even more equipment this year to AHS. The FACS program. They've implemented programming to reflect results from the Youth Risk and Behavior Survey, and that includes emphasis on stress management, the importance of wellness behaviors, sleep, adequate sleep, etc. They not only have been working with students on healthy foods and lifestyle, money management, and consumerism, but as mentioned, added the components of mental health, wellness, which is greatly needed. Hey.
So sorry. Thought I clicked the elevator.
Oh, that's why I took the stairs.
I tried, and then the door was stuck.
We're a wellness committee. We have to take the stairs.
Yes, I did, and then the door was stuck. I apologize.
And welcome Ivy
This is
LaPlante,
Ivy
right?
Yes.
Thank
Yes,
you,
hello.
welcome.
Thanks, Sue.
No worries.
Sorry, how far
no,
along did you get?
We started early.
Oh, okay, good.
Yeah, I'm literally on page 1.
Okay.
You're at the auditorium.
Oh, good.
So the Safe Routes to Schools initiatives, robust programs throughout the community. Just going to move this a little bit just in case. Continues to have monthly meetings, participation in bicycle and walking programs, safety trainings and surveys. So that's going quite well. And I believe everybody has this in advance, this information in
Yes.
advance. Okay, great. Food services, they continue the USDA Fresh Fruit and Vegetables Expanded Program to the schools, more scratch cooking, less processed foods available, expanded breakfast options, and Try It Tuesdays to introduce different foods to students. They've been working with the schools regarding composting procedures, as well as working with students and families on alternative food fundraisers, seeking to decrease unhealthy food sold for fundraising programs and purposes. They've also been working with Arlington Eats in the community, and they hope to expand to the Audison. I really hope they expand to the Audison because we have about 8 to 10 students coming down a day for snacks because they don't have breakfast. Parent and community forums. In September, there was the invitation sponsored by the Minuteman Safety and Health Collaborative in offering important health and safety tips for children entitled Passport to Bike Safety. Other Arlington forums included the opioid crisis, the trans umbrella, guiding good choices, smoking cessation, and hypnosis, the talk with Dr. Shine, marijuana use in the teenage brain with Dr. Scott Hadland, mental health and suicide awareness night, parenting for success with less stress, or how to succeed without seceding from family, and adolescence is hard work with Michael Thompson. So I'm only going to touch on a few things with the Sanborn accomplishments because there are quite a few, as listed. Arlington High advisory activities, courtesy of Club 84. There's all sorts of information on for all staff on e-cigarettes because that's becoming a growing problem. It's easy to hide these vapes, as they call them. Handbook updates on tobacco use, and e-cigarettes, and they've developed a commercial for Club 84 to be played during Club Day Advisory at the end of October. That happened already. The Great American Smokeout, social media outreach, and let's see, there's a lot. Club 84 did quite a bit, actually, and smoking cessation classes continue for first-time offenders. Planning for a skin, that should have actually, I don't know if that happened yet, Skin Cancer Awareness Day. And 15 Arlington High students attended the State House on March 16th to celebrate Kick Butts Day. And part of that was also part with Club 84. There's a lot there. I'm not going to read it all because there's quite a bit of information there. Relay for Life continues with in assembling teams, students directly involved with the Arlington Youth Health and Safety Coalition. And you've done some wonderful, producing some wonderful materials and newsletters with that. Very, very professional and robust. Ottoson Middle School, Carlene Newell continues educating 405 students with preventing smoking, guiding good choices, as well as the parenting workshop mentioned previously. Elementary schools, she continues to promote guiding good choices there as well. And the elementary health curriculum continues being taught by teachers, PE teachers, and nurses as well. Let's see. I don't want to have to read every single thing on here. Relay for Life, students in Arlington raised $56,497 in June 2015. See what they raised this year. That's very impressive. All right, and many things that we've already kind of mentioned. So I'm going to go into some of the nursing initiatives because it's been a very robust year. We had a grant from the SIMS grant, which gave us funding to run something called the OMS Web standing acronym for Wellness, Energy, and Balance. It was a Monday afternoon program open to all students in the middle school, run by the two RNs, Julie Melee and Kristen Keneally. It was well attended, though we would have liked to have seen boys. This was not attended by boys, seemed to be girls. It was to look at mindfulness as alternatives to stress management, and they did all sorts of fun stuff. They will be presenting their program at a statewide meeting May 19th. The Innovative Care Coordination Grant from Mass Department of Public Health has funded 2 years of nursing coordination, almost full-time. These 2 years we focused on mental health issues at Ottoson, originally high school and then the Ottoson, and throughout the district. This continues to be a serious issue, having the adolescent population not knowing how to deal with stress and having a hard time. I did not bring in a PowerPoint presentation because our statistics this year are pretty comparable to last year. We have 2 to 3 times the amount of encounters in the last 3 years this year as we did 3 years ago, excuse me. So and a lot of these are related to mental health, school aversion, kids just not wanting to be in school or attending, having a hard time, having their phones with them so that they're caught up on social media while they're in school, tends to bring them down a little bit. Let's see. For many reasons, we reapplied for the grant this year, but we're focusing on diabetes and asthma management, and we will see, hopefully in the next few weeks, whether we get that grant. Last year it was $35,000. I was given, plus change, some information that their DPH is looking to decrease funding on that because there are more. We piloted the program and it was so successful, there are more communities that now want to do it. So I don't think we're going to get as much this year if we get it at all. The reason we're focusing on diabetes and asthma is because those numbers are drastically increasing in our community once again. There's a higher concentration of students in the Thompson area with diabetes. We received the AEF grant to promote care coordination in the elementary schools. That was very successful in our programming. The care coordinator went out to work with school nurses in the elementaries, specifically to help on cases of children with high absenteeism or chronic medical conditions. Again, diabetes came into play with that. This promoted greater engagement to local medical providers who are often unaware that their young patients were out of school so much. So we're getting some really good feedback on these programs. The elementary school nurses have a greater understanding of the protocols, guidelines, and outcomes related to this outreach. It was a successful endeavor. It's a one-year grant, but we're really glad we did it. We hope to continue to have the Essential School Health Grant from the DPH next year. This year, we had a little over $69,000 for that. It helps to fund our conferences and educational opportunities. It also gives us extra nurses in the schools to help out with the many different things that we're doing. The state just requires more and more from us, and there's more and more students to see. So I sincerely appreciate that the school committee has increased nursing coverage at the Audison, getting us closer to state guidelines in regard to the nurse-to-student ratio. Let's see, what else did we do? We've housed nursing students this year from UMass, Regis, and Northeastern at the Brackett, the Bishop, the Hardy, the Pierce, and the Audison schools. I'm a CPR instructor, so we were able to save quite a bit of money training in-house. We didn't have to send people out because we just did it for free. And the Arlington Health and Human Services ran the flu clinics for all the students in the schools last fall, and they are now setting up the dates with the principals to run them again in the fall. We could not offer this to the staff because DPH did not give it to us. They give it to us for free for students, but it does not come free to anyone anymore. And then recently, to wrap things up from my end, we received a $10,000 grant from Mass DPH for the initiation of mandated screening regarding substance abuse. I will defer to the SBIRT, S-B-I-R-T grant and information to my colleague Ivy LaPlante, who, as I mentioned earlier, is the director of the Arlington Youth Health and Safety Coalition.
Okay, thank you, Sue. Yes, so SBIRT is what it's commonly called. It stands for Screening, Brief Intervention, and Referral to Treatment. And just recently, the governor, Charlie Baker, mandated this type of screening for all Massachusetts public schools. Sue was really forward-thinking in trying to get the grant. She saw that this was the way that the governor was going to go, and it was great because it allowed us to plan for this sort of screening before it actually happened. So I really thank Sue for inviting me into the program and for involving the Youth Health and Safety Coalition. As she mentioned, we do focus on substance abuse prevention, and a lot of those initiatives, especially the tobacco initiatives for Club 84, are spearheaded by our youth coordinator, Karen Dillon, who works directly with the Arlington High School Club 84 program. So it was really nice to hear the connection between our coalition and the schools. Going back to SBIRT, screening, brief intervention, referral to treatment, like I said, is a now mandated screening process in the public schools. And really, it's exactly as it sounds. You know, it's a very simple screening process where students will be asked a series of questions, and depending on how they respond to them, you know, have you ever ridden in a car with somebody who's used substances? Do you yourself? Have you had a drink of alcohol in the past 30 days? Depending on how they respond, they will be given referral to treatment and kind of sort of like a small brief intervention. Our plan is to screen all 7th graders in the Audison, and our thinking behind this is because, as you can see from the data in the packet, the majority of students are not using substances. However, when they do start, they're starting as early as 7th and 8th grade. So our goal is to stop use before it even starts. And so this screening allows nurses to be able to talk to every single student in the Audison, all 7th grade students, and get them the treatment that they need. By pairing with the coalition, you know, we have the resources specifically for substance abuse prevention and connection to educational resources in the community. Every student will be given a packet after screening, so they all will receive the same information, so no student will be singled out. You know, oh, why did Joe receive a packet but Susie didn't? No, every single student will receive the same type of information, just to try to keep it as fair as possible. The majority of students screened, they've done pilot studies in the past, and the majority of students actually screen negative for substances, it's great. And you might ask, well, why should we do this screening if the majority of students are screening negative? because every single student receives a brief intervention and a positive reinforcement of the behavior that they're doing. So if these students are already making good positive decisions, specifically in avoiding substances, then they're being reinforced and reaffirmed for their positive decisions. Some logistics, we plan on rolling this out in November of next year. And we are currently working with the Audison principal and vice principals, and as well as nursing teams as well. And our plan is to have the nurses screen the students during PE courses, so that when the students are kind of running around playing kickball, they're not noticing that their classmates aren't there. The fact that every 7th grade student will receive the same screening is also a way to kind of keep it as fair. And I do want to highlight that this is a confidential screening, so the students, anything that they say will just be between themselves and the screener. I think, I don't know if, Sue, did you want to add anything, or I can open this up for discussion, for questions?
Yeah, we'll open it. Thank you very much.
Sure.
Great presentation. Why don't I just open up Ms. Schlickman?
Yeah, I mean, I seem to remember the stress issue is, seems to be magnified. I seem to remember from last year's data that that our young women have higher incidence. Was that true?
It's a good question.
With stress?
Young women?
Yes, I think that because kids still continue to be hospitalized for mental health reasons, and the majority of them are young women, yes.
Yeah, because when you mentioned that you had your stress management event, and it was all girls there.
All girls.
I thought that was sort of telling us data from last year.
Right.
Is there something we need to be doing as a district to sort of make our environment better for this?
Yeah, shut down social media. I'm serious, because I live it at home. So that's a really good question. And, you know, and that's not to say that young men don't have this as well. Certainly they do, and we see a lot of it. That's not to negate that fact. But I don't know. I mean, I really think I think it's a perfect storm of things that cause it, to be honest with you. And it's trying to be addressed in many different respects. And I was reading the district goals, which are clearly aligned to social and emotional well-being. This is not, like I said, this is not just specific to Arlington. This is everywhere.
Yeah, I know.
So I wish I had the answer. I think it continues to be, you know, supporting kids and letting them talk about what they need to talk about. And but how do we, you know, reach them? I mean, I have my theories, and that $2 will get you a Starbucks coffee. But I think we just have to continue fighting the good fight with this. And it's a lot of it's parenting too. We want to see good, strong parenting at home with this. It's, you know, we can't fix this just in the schools.
Yeah.
I don't know if I answered your question. But
That's okay. I mean, social media is for cat pictures,
Yeah.
right?
Exactly.
That,
You
it
got
shouldn't
lots
be
of those.
stressful.
no, but when you see
I know,
all the
I know.
parties you're not invited to,
Yeah.
you know, and everybody puts their perfect face on social media, we don't realize how human we are. There's a great book by, I don't know how to pronounce her name, I think it's Brene Brown, called The Gifts of Imperfection. I'm not into self-help books, but someone recommended that I read this because I also teach. And I did, and I thought, wow, this is really, this woman's nailed it with her perspective on why we're seeing this, not just in youth, in adults too. I mean, I teach at a college and I work in college health also. And I'll tell you, the transition goes straight through college. Like I've never seen, I've been in college health in the same clinic for 5 years, and I've never had so many freshmen come to see us at the beginning of the school year. They're not ready emotionally. They're not, many of them. I shouldn't say all of them, but the numbers are pretty staggering as to what I see. Kids that just can't, they don't have the resiliency to take care of themselves at that point. So, and that's just all based on stress and anxiety and.
You know, the fact is that everybody looks perfect on social media.
Of course they do.
That's not a unique phenomenon because, you know, I remember I graduated from high school quite some time ago, obviously, but people, you know, I thought I was the only teenager going through certain things or liking certain things or whatever. And then, as an adult, when you get to know people on a real level and not in this high school setting, you find out how much you had in common with folks that you never thought they were anywhere near where you were at. It can be such a lonely time because you feel like you're the only one going through this. And adults, one of the things that I find with adults is they think that high school is such a wonderful time, but you're really so restricted in your options. It's in many ways it's very confining and very stressful to go through this episode of trying to develop yourself as a person within the context of living with your parents and going through a high school with people you were with since kindergarten.
A lot of our students, so we work directly with youth in the high school, and hoping next year we'll work more with our middle school students. And a lot of our students say that the stressors that cause this anxiety, this frustration with school, is because of a lack of things to do. Now, I don't know if that's just the idea of social media and seeing all of the perfect world of celebrities, or if it's the fact that they really do not think or believe that there is anything to do. And so a lot of our students are turning to alcohol and to drugs because they think that is a way to have fun and to fit in. When we see that the majority of our students are not using substances, but they perceive that they are because the ones who have fun are the ones who are using substances and, at these parties, posting on social media, what have you. So, it's definitely one of our goals is to create more opportunities to support youth and to give them, more fun things to do that aren't drugs and alcohol, that are just, getting together, gathering. I mean, students talk so much about the last blast and how much fun that's going to be, and how, even students who have graduated come back and they say, oh man, we wish that we had 5 last blasts. That was so much fun because we were just with our classmates hanging out. So we're really looking for opportunities to kind of create that cohesive, fun times where students can just be kids.
Thank you. Ms. Starks.
So my question was about the testing. So it sounds like it's a one-on-one conversation with each student.
Yes, correct.
And is it like, so it's the same person who talks to all the students?
So the screening, Espert, we have a screening team, and it's made up of all the school nurses, essentially. And then what we're going to do is essentially split up the class between the 4 or 5 nurses that we have doing the screenings, and give them a list of students to screen. And what I'm going to do beforehand is make sure that the nurse doesn't have a personal relationship with the student. We don't want them to be the neighbor of somebody because they're going to be disclosing this personal confidential information. But there's only so much you can do to protect that. With that being said, after the screening, we're going to gather as a team along with all the guidance counselors at the Audison and discuss these cases. So anytime that there is a student who has identified as a risk for developing a substance use disorder, that's essentially what the screening identifies. We'll have a chance to go through the process and talk to the person who screened the student. Will be able to talk about the issue with the student's guidance counselor and then refer to services if they need to.
With the student's consent.
Correct,
Yeah.
with the student's consent. Because again, this is a confidential screening between the student and the screener.
And do we think that we might expand it in the future to other grades, or just always, it seems to me, if you've hit them, that's great, but then what happens in 9th or 10th or?
Will we?
That's a great question.
So the mandate from the state said pick one grade to
Just
start.
one, okay,
But the plan is to we'll start with the middle
7th
school,
grade.
because we want to get them young,
yep,
and then expand to the high school the year after. So I think the high school
like
is going to
7
be
and 9,
ninth grade.
yeah.
Yes, yeah,
Um,
that's what we're thinking.
Yeah, and so we're piloting it this
Oh, okay.
coming year, and we'll see, but it's a work in progress.
all right, cool.
It's the same screening tool that we use in medical offices.
Yes.
It's a pretty commonly used screening tool.
Okay.
Nothing unpredictable.
Cool, thanks.
Mr. Hayner.
2 questions, one related to this. Do you see any connection between this issue and the anxiety?
Between substance use and
Yes.
anxiety? Oh, definitely.
Okay. The other question I have, Do you have statistics breakdown on grade levels at Audison on the anxiety?
Yes, I do.
I guess.
I don't have it with me.
No,
but-
no, no, that's not, if I may expand, I'm just seeing the issue of the new students coming in, sixth graders coming from the elementary schools, not knowing anybody, a higher level of anxiety on entrance. I mean, anxiety is caused by, as you said, social media and other things like that.
Yes.
But that particular thing, and being new in the building and stuff like that, I don't know.
I don't see that.
You don't see it?
No, I don't see that. I mean, that's not to say there aren't sixth graders dealing with anxiety. There certainly are. I think it's the seventh and the eighth graders more, to be honest with you.
Are you able to determine, that
We
you
could
seem very
break
strong
down
on,
those numbers.
on the, one of the major contributing factors is the social media?
That's my personal belief.
Okay,
And I apologize if I didn't preface that. My personal belief because this is what sometimes the kids will come in and say, you know, they're really upset,
right.
but they won't tell you at first.
Anxiety in school has been there forever.
Yeah.
And I'm an example of forever. I didn't have, the social media was just talking to somebody and asking a girl out when she said no, I'd be crushed, like that. Now it gets published throughout the whole building.
Exactly.
To make it worse. Okay, thank you.
Exactly.
I was just looking at our youth risk behavior survey data. We just received our brand-new data today, this morning. And it's not even an electronic version, otherwise I would have shared it with you all. Once I get that, I'll be able to share it. But I was looking at it, and we ask a question, you know, what brings the most stress to your life? This is high school students. We ask them homework, friends, is it family problems, is it future thinking? And the majority of them say homework. You know, homework is what brings me the most stress, and future planning is also. And if you take those two issues, you can't eliminate homework and you can't eliminate future planning. So it might just be the compounded effort of, you know, everything that's adding to it, so. And I'm sure we have that data as well for the middle school, and it's broken down. It's on the website.
So, yeah, we can pull up
You can pull it up.
very specific data as, you know, how many kids, we can divide it out by grades, what they're coming
Yes.
down for specifically.
Yeah, and I'm sure you have like actual data too.
But it's pretty comparable to last year's data.
Thank you.
Anybody other questions? So my question is, do you have data if you look back at data, and how far back can you go, and what do the trends tell you? So is there an increase in stress in our students statistically?
Yes.
And how far back does your data go?
I have a graph that's coming to my head right now from 2009, 2011, 2013, and 2015. So those 4 years, and we are seeing an increase in stress among high school and middle school students.
All grade levels?
All grade levels.
Okay.
Even the little ones, I mean,
Even elementary school students? So there's an increase in stress. And you think that trend line from 2009 to 2013, 2016 is media-related as well? That's your theory, right? So
oh, yeah, but.
Are there
I'm
other
not a psychologist.
I know.
I know.
I just want to preface that.
Okay, but are there any other theories? I guess even more than theories. When you're talking to students, and you're interviewing them, and you're doing an assessment of their situation, what other things do you see besides my friends were invited to a party and I wasn't, and I saw it on social media, I saw it on Facebook or wherever they saw it.
Certainly a lot of peer issues. I think that's probably number one. But they will talk about the stress of their work in class.
Yeah,
Sometimes we can even look to see if there's a trend of which class they're coming from a lot.
yeah.
And home life, sometimes they'll say things are tough at home. But I would say peer issues are number one.
If I-
Yeah, and Dr. Chesson, I was going to ask you the next question, so good.
One of the things that many districts have started to look at, there's actually a documentary called The Race to Nowhere. And it is very common at the high school level for students to feel a pressure, unlike the pressure that we might have seen before. Vast majority of kids are going on to college, where before might have been other options. You might have gone into work, or it might have been more acceptable or more common to go into the service. Now that the vast majority of kids are at least striving to go to college, it doesn't surprise me that you say homework. We see kids in the past, when kids used to take 1 or 2 AP classes, now it's the norm to take 4 or 5. And that creates a level of stress and anxiety for students. And that's something we're going to be working on. That's one of the reasons that we were happy to get a grant from the Arlington Educational Foundation to really look at safe and supportive schools and to do a master plan over the summer for a K through 12 program.
Thank you. Because that's where I was getting at. I think social media is certainly a part of it. I also think that we have, raised our standards. This is a town with higher expectations for young people. It's more competitive education, academically, which is all very positive, something we've worked on as a committee. We've wanted to accelerate academic outcomes. We've been working hard on that over the past decade or so. But I think one of the outcomes of all that is that increases stress.
Well, sure, because what are all the seniors doing right now?
Yeah, they're stressed. Well, it's May, so they've already decided, right?
They've decided, but it's all still being posted. And
Yeah.
about those at a wait list, look, and
Yeah.
I'm living this right now, so I can,
I know.
I can tell you. The wait lists, they're, I joke around with everybody and say, well, right now, my daughter's a puddle, the
Yeah.
whole thing has been stressful, and it's, I just compound that throughout the district. And it gets worse. I was just thinking the other day, if there's X amount of colleges, but the population's increasing, it's a lot more rejection letters, right? So, because there's fewer spots in the colleges to take these students that are coming up. I mean, Ben and Jerry's has to come out with an ice cream seasonally called rejection letter. You think I'm serious?
I believe it. I believe it. That's why.
Yeah,
I'll buy
that's right.
So,
Well, the other thing with college acceptances is the technology makes it easier to apply for more colleges.
right.
So you've got more people applying for seats, so, more of a chance for rejection on that front alone.
And more students applying.
Yeah.
Exactly.
So
More
it's huge.
Exactly.
So in this summer, you're going to be doing some planning around how do we provide more support? How are we more proactive?
Yep, K through 12 safe and supportive schools.
Good.
That'll be the summer.
That's part of our goals, proposed goals
It is.
for FY17.
Great goal.
Yeah, that's great.
All right. Any other questions?
I would like to just say one thing.
Sure, a
I
comment,
wanted
yeah.
to do a shout out to Julie Dunn.
Yes.
She
Oh, yeah.
helped me write a lot of the grants that we received in the last few years, and she's been phenomenal. So I just want to let you know, I think that I greatly appreciate the work that she's done.
Very talented.
Julie Dunn is the grant administrator and also the director of communications for the district, and she does a phenomenal job.
She does.
All right. Thank you very much. Appreciate it.
Thank you.